Hey there, health enthusiasts! In today's video, we're diving deep into the world of zinc supplements and how they can boost your immunity and overall health. We'll explore the various forms of zinc supplements available, their recommended dosages, and the potential benefits for your immune function, wound healing, age-related macular degeneration, and even acne. Plus, we'll discuss the safety and side effects of zinc supplements to help you make an informed decision about whether they are right for you. So, grab a notepad and get ready to learn everything you need to know about the best supplements for zinc. Zinc is an essential mineral that plays a crucial role in many aspects of our cellular metabolism, immune function, protein and DNA synthesis, wound healing, and cell signaling and division. Shankar and Prasad, in their 1998 study, along with Hambidge in 2000 and Solomons in 2013, have all highlighted the importance of zinc in supporting healthy growth and development during pregnancy, infancy, childhood, and adolescence. Despite its importance, zinc deficiency is a common problem worldwide, particularly in developing countries where diets are often low in zinc-rich foods. Prasad, in a 2008 study, noted that even in developed nations, certain groups such as the elderly, vegetarians, and those with digestive disorders may be at risk of inadequate zinc intake. That's where supplementation with the best supplements for zinc comes in, helping ensure optimal levels of this essential mineral and supporting overall health and well-being. Now let's talk about the different forms of zinc supplements available. You've got zinc picolinate, zinc citrate, zinc acetate, zinc glycerate, and zinc monomethionine, each with varying absorption rates and bioavailability. Wegmiller and colleagues, in a 2014 study, mentioned that while zinc picolinate and zinc citrate may have better absorption rates than zinc oxide, more research is needed to determine the optimal form for supplementation. Zinc picolinate, in particular, has been shown to have superior absorption compared to other forms, as demonstrated by Barry and colleagues in a 1987 study. They compared the bioavailability of zinc picolinate, zinc citrate, and zinc gluconate in healthy adults, and found that zinc picolinate had significantly higher absorption and retention than the other forms. Zinc citrate is another well-absorbed form of zinc, and a study by Wegmiller and colleagues in 2014 found that both zinc citrate and zinc gluconate were equally well absorbed in healthy adults. When it comes to zinc acetate, this form has been extensively studied for its potential in reducing the duration and severity of common colds when taken in lozenge form. Hemiller, in a 2017 meta-analysis of 7 randomized controlled trials, found that zinc acetate lozenges, providing a daily dose of 80 to 92 milligrams of elemental zinc, could reduce the duration of common colds by 33%. Zinc glycerate and zinc monomethionine are less common forms of zinc supplements, and while they may have potential benefits, more research is needed to establish their efficacy compared to other forms, as noted by Wegmiller and colleagues in their 2014 study. So how much zinc should you be taking? The recommended daily allowance, or RDA, for zinc varies by age and gender. For adults, the Institute of Medicine, in a 2001 report, stated that the RDA is 11 milligrams per day for men and 8 milligrams per day for women. Pregnant and lactating women require slightly higher amounts, with an RDA of 11 to 12 milligrams per day and 12 to 13 milligrams per day, respectively. Most zinc supplements contain between 15 to 30 milligrams of elemental zinc per serving, which is sufficient to meet the RDA for adults. However, it's essential to note that the tolerable upper intake level, or UL, for adults is 40 milligrams per day. Consuming zinc in excess of this amount may lead to adverse effects and interfere with the absorption of other minerals, such as copper, as mentioned by Maret and Sandstead in a 2006 study. In some cases, high-dose zinc supplementation may be recommended for specific health conditions, such as age-related macular degeneration, as seen in the AREDS Research Group's 2001 study, or the common cold, as noted by Hemiller in 2017. However, it's crucial to consult with a healthcare professional before exceeding the UL of 40 milligrams per day, as long-term high-dose zinc supplementation can lead to copper deficiency and other adverse effects, according to Maret and Sandstead's 2006 study. Now, let's dive into the potential benefits of zinc supplementation. starting with immune function. Zinc plays a critical role in the development and function of the immune system, as it's involved in the regulation of T-cell and B-cell lymphocytes, natural killer cells, and macrophages, all of which are essential components of the body's defense against pathogens. Shankar and Prasad, in their 1998 study, highlighted this crucial role of zinc in immune function. Zinc deficiency has been associated with impaired immune function and increased susceptibility to infections, as noted by Prasad in a 2008 study. Supplementation with zinc has been shown to enhance immune response and reduce the risk of infections, particularly in elderly and zinc-deficient individuals. Agarwal and colleagues, in a 2007 meta-analysis of 13 randomized controlled trials, found that zinc supplementation could significantly reduce the incidence of acute lower respiratory tract infections in children under 5 years of age. When it comes to the common cold, zinc has gained attention for its potential in reducing the duration and severity of symptoms. Hemila, in a 2017 meta-analysis of 7 randomized controlled trials, found that zinc acetate lozenges, providing a daily dose of 80 to 92 milligrams of elemental zinc, could reduce the duration of common colds by 33%. However, it's essential to note that excessive zinc intake can lead to adverse effects, such as nausea and altered taste perception. Moving on to wound healing, zinc is crucial for proper healing, as it plays a role in collagen synthesis, cell proliferation, and immune function, as mentioned by Lansdowne and colleagues in a 2007 study. Zinc deficiency has been associated with delayed wound healing and increased risk of infection. Supplementation with zinc has been shown to improve wound healing rates in zinc-deficient individuals. Momin Heravi and colleagues, in a 2017 randomized controlled trial involving patients with diabetic foot ulcers, found that oral zinc supplementation, in addition to standard wound care, significantly improved wound healing compared to placebo. Age-related macular degeneration, or AMD, is a leading cause of vision loss in older adults. The Age-Related Eye Disease Study, or AREDS, published in 2001, found that supplementation with a combination of antioxidants and zinc at 80 milligrams per day as zinc oxide could reduce the risk of progression to advanced AMD by 25% in high-risk individuals. A follow-up study, AREDS-2, published in 2013, investigated the effects of modifying the original AREDS formulation by adding omega-3 fatty acids, lutein, and zeaxanthin, and reducing the zinc dose to 25 milligrams per day. The study found that the modified formulation was as effective as the original in reducing the risk of AMD progression, suggesting that lower doses of zinc may be sufficient when combined with other nutrients. Lastly, let's talk about acne. Zinc has been studied for its potential in treating acne vulgaris, a common skin condition characterized by inflammation and the formation of comedones, papules, and pustules. The exact mechanisms by which zinc may improve acne are not fully understood, but it's thought to involve its anti-inflammatory and immunomodulatory properties, as noted by Cervantes and colleagues in a 2021 study. A systematic review and meta-analysis by Cervantes and colleagues, published in 2021, looked at 10 randomized controlled trials and found that oral zinc supplementation, particularly with zinc sulfate, could significantly reduce the severity of acne lesions compared to placebo. However, the optimal dose and duration of zinc supplementation for acne treatment remain unclear, and further research is needed to establish evidence-based recommendations. Now, let's address some important safety considerations and potential side effects of zinc supplements. Zinc supplements are generally well tolerated when taken at recommended dosages. However, excessive zinc intake can lead to adverse effects, such as nausea, vomiting, loss of appetite, abdominal cramps, diarrhea, and headaches, as mentioned by the Office of Dietary Supplements in a 2020 fact sheet. Long-term high-dose zinc supplementation can also interfere with the absorption of other minerals, particularly copper, leading to copper deficiency, as noted by Marrett and Sandstead in their 2006 study. To minimize the risk of adverse effects, it's essential to adhere to the recommended dosages and not exceed the tolerable upper intake level of 40 milligrams per day for adults, unless under the guidance of a healthcare professional. Individuals with certain health conditions, such as chronic kidney disease, or those taking certain medications should consult with their healthcare provider before starting zinc supplementation. Zinc supplements can also interact with several medications, potentially affecting their absorption or efficacy. Some notable interactions include antibiotics like quinolones and tetracyclines, where zinc can reduce their absorption, as mentioned by Pentila and colleagues in a 1975 study. Zinc can also decrease the absorption and efficacy of penicillamine, a medication used to treat rheumatoid arthritis and Wilson's disease, as noted by Sanchez-Martin and colleagues in a 2017 study. Prolonged use of thiazide diuretics can increase urinary zinc excretion, potentially leading to zinc deficiency, as mentioned by Reyes and colleagues in a 1982 study. It's crucial to inform your healthcare provider about all medications and supplements you're taking to avoid potential interactions and ensure the safe and effective use of zinc supplements. In conclusion, zinc is an essential mineral that plays a vital role in numerous aspects of human health, including immune function, wound healing, and eye health. With various forms of zinc supplements available, such as zinc picolinate, zinc citrate, and zinc acetate, individuals can choose the most suitable option based on their specific needs and preferences. The recommended daily allowance for zinc varies by age and gender, with most supplements providing between 15 to 30 milligrams of elemental zinc per serving. The potential benefits of zinc supplementation are well documented, particularly in supporting immune function, reducing the duration and severity of common colds, promoting wound healing, and slowing the progression of age-related macular degeneration. Additionally, zinc has shown promise in the treatment of acne vulgaris, although further research is needed to establish optimal dosing and duration of supplementation. However, it's essential to exercise caution when taking zinc supplements, as excessive intake can lead to adverse effects and interfere with the absorption of other minerals, such as copper. To ensure safe and effective use, individuals should adhere to recommended dosages, not exceed the tolerable upper intake level of 40 milligrams per day for adults without medical supervision, and be aware of potential interactions with medications. By incorporating the best supplements for zinc into a well-balanced diet and lifestyle, individuals can support their overall health and well-being. And that's a wrap on our deep dive into zinc supplements. If you found this video informative and helpful, be sure to visit nutritionmarket.com.au for more information and resources. At Nutrition Market, you can find all the best supplements to support your health goals, and we even have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice tailored to your unique needs. Don't forget to hit that like button and subscribe to our channel for more informative videos on health and nutrition. And remember, while the content in this video is informed by research, it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, so always consult with a qualified professional for personalized guidance. Thanks for watching, and we'll see you next time.